from Academically, and this is a very special session for ADC Masterclass. So as you must be aware that ADC is the gateway to work in Australia. So over your screen, you can see right now, it's about the team of Academically. Academically is one-stop solution for global healthcare professionals seeking a broad migration and career advancement opportunities. Based in Sydney, Australia, the team academically engages with global healthcare educators, healthcare industry experts, universities, and higher education institutes to provide demanding healthcare courses for global audiences. So, as you can see on your screen, as well as you must be very much aware and right now in the chat with Dr. Akram. So, over to Dr. Akram. Uh, Sir, you can just.
Thank you, Bharti. This is a very short, brief intro about me. So my name is Dr. Akram. So I'm around 10 years of teaching experience for clinical pharmacology for pharmacy and medical students in India, Malaysia, and Australia. And last 6 years, I'm trying to make the impact on healthcare professionals, helping to migrate Australia up to the YouTube. I'm making the content, to aware how you can migrate to Australia. But as a dentist or in general, basically any healthcare professional want to migrate to Australia, you have like a 3-4 in general steps you have to complete. For example, like document verification, then ADC exam, then English preparation, and then you can migrate to Australia. This is very general for ADC. So ADC have two part 1 and part 2. So we are talking about part 1 exam. So we will help you to complete your documentation process, and then your this part 1 and English, then easily you can migrate to Australia. So at Academically, we are providing the all other courses. As you know, we have around 90+% the success rate so far from other exams like CAPS exam, AIMS exam, and CLAT, and so on. And around 55 countries students to migrate to Australia and the exams. Here are a few of the achievements from Academically. Yeah, next I think I will talk to you one-on-one. If you have any questions to me or Dr. Ankita is here. She is your mentor for this ADC preparation. She will teach very short class. So I'm going to hand over to Ankita. And once finish this, Ankita, then we will talk to you one-on-one. So if you have any doubt or questions regarding the exam or anything, you can ask her. Okay, over to Ankita. Dr. Ankita, welcome.
Thank you, Dr. Akram, for very warm welcome and my introduction. About myself, I'm a master's in pediatric dentistry from India. My BDS was from Manipal, Karnataka, one of the candidate mentioned. So we share the same alma mater. And I was second rank holder at university level in my master's. I have taught in the state of Gujarat. Again, one of the candidate hails from Gujarat in one of the private university. And since 9 years, I'm in Malaysia teaching in a private university. I undertook ADC Part 1 exam in 2019. My Part 2 is pending. I'll be appearing the exam next year. And yeah, because of the COVID, a brief halt happened in Part 2. That's how, but sharing my experience of Part 1 journey and taking you through, steering it through, I'll be really very happy sharing my knowledge, my experience, and navigating your journey across to ADC Part 1 exam in Australia. So basically this exam preparation course, first we are launching the ADC Part 1 course, because ADC has 2 parts exams. All of you who are just navigating scene to go to Australia to practice as a dentist. So Part 1 is an online exam, and it happens at various locations in Australia as well as outside Australia. So you can register at these test centers. For 2024, the applications will open in November end and December first week. So till 12th December, the applications will be open. And you would be able to register for the Part 1 exam, provided you have got your initial assessment done. The initial assessment last date is over for this year. Last date was 18th October. So if you have that initial assessment done, you can proceed to Part 1 registration, which is opening soon. And Part 1 exam of Australia is checking your knowledge, okay, and just application of knowledge. It's not just, they're not asking the real they're not asking the textual questions. Okay, how much percentage of this much LA is there in a syringe? You get into calculations, or what is the adverse effect of this drug? They are not asking anything direct. They are asking everything as a clinical scenario. So that is the big change about Australian Dental Council exam. Moving on, this course will be a highly packed, valuable course for you to steer towards ADC Part 1 exam. Okay, about the exam, it's the license to practice in Australia. So one has to clear Part 1 and Part 2. Part 2 is completely clinical exam. It's communication as well as the technical tasks. We will get through that later on. But for now, our agenda or focus is to give you a glimpse of Part 2 exam and take you through the journey of how to read for that kind of exam. And who is eligible to take this exam? Eligibility to appear for ADC exam is you should have done in your home country 4 years of full-time dental degree from any recognized university, which is in your home country. And you should have registration in your home country. So if you have done it from India, Pakistan, or Nepal, you should have registration as a dentist in your home countries. And there should be no objection certificates from your councils, dental councils. You have to submit it directly to the ADC. Suppose if you have done your home country BDS, your license will be sent directly to you. You have to pay the money or have to resource your direct certificate to reach ADC so that they know that this is coming directly from your dental councils. So if you have any concerns about it, or if it is still not clear, please get in touch with us. We will help you out with this. And like the ADC course, which Academically is offering, it's a 12 weeks of intensive sessions, 120 hours of live online learning. We won't leave you, dump the materials to you and say, prepare on this and come back. We will handhold you, guide you, so that you can practice the questions which come in exam, teach you through what is their expectations. See, you might be a very good dentist in your home country, but to practice in Australia, we need to learn what they expect out of us. So that is what the course will cater to. You will have access to the preparation material till you clear the exam. And all the recall questions, what are ADC favorites, what is their hinge going every time, which subjects, which topics they are time and again asking. We will lead you to those areas. ADC exam pattern, the most critical part. What is the pattern of their exam? Again, divided into written and the practical. Written exam centers are always outside Australia also. As I mentioned, they are in Asia. In India, they are in many places. Okay, they are in Delhi, Gurgaon, Bangalore, many cities of India. For Pakistan candidates, recently they might be opening the one center in Pakistan soon, but it is not sure or not confirmed till now. And but they have centers in Abu Dhabi. So that would be the nearest center for a written exam. But for the practical exam, the only center is in Melbourne. So after you clear the written exam, you would have to apply for a tourist visa, go to Australia and take up the practical exam. So that is, again, it has to be catered only in Australia, the Part 2 exam. Again, practical exam is conducted over 2 days One day is assigned for checking your clinical skills and other days for checking the technical skills. We will get into the nitty-gritties of it, otherwise you will lose on the topic for the day. But still, if you want me to touch base on anything, you can always ask in the question and answer round. Now, let me begin with the main deal of the day, our masterclass, which is on dental traumatology. Now, dental traumatology, I have seen as a pediatric dentist, the children and adults undergo trauma a lot. And we have many guidelines which follow or which tell you the treatment plan. But as I mentioned before also, ADC doesn't pay heed to the bookish knowledge anytime. They say the patient came to you. This is the patient coming to your clinic and asking you to do so. So I have charted this master class as a patient coming to your clinic, and I will also go through the details of the trauma later on so that you are not in haze that what terminologies I am using. So this masterclass I have kind of created, even if you have not done your BDs, you will be able to get to roots of trauma to an extent which would be building on your knowledge from your BDS. Okay. So a 6-year-old boy comes to you. The boy has a facial injury, and this child makes an appointment, which is an emergency appointment. ADC asks you, assess the child and decide what treatment the child needs. So this is the extraoral, the image of the face. So as you can see, there are bruises on the lip, upper lip, on the nose. So it is never dental trauma alone. It is always a craniofacial trauma. Whenever the injury happens, it is involving the face and the surrounding regions. Now, history of the trauma. Child says that he has loose front teeth and his mouth is sore and it hurts to eat. Then you have to probe into how did this trauma happen. Okay, the child's mother would, obviously it's a 6-year-old child, so mother will say that he fell off his skateboard, banged his teeth. The injury occurred last evening while he was playing at the friend's house. Dental history says that family attend your practice occasionally, and since some time the child has not visited you. Medical history, patient is otherwise fit and well. So we will get into the history questions, asking the history questions soon. Let me take you to the another slide. This is the clinical presentation, intraoral. So intraoral, you can see that these are baby teeth, right? How many of you can identify this is the baby teeth? 6-year-old child, you should be very well prompted. 6-year-old child has front teeth, which are baby teeth. Okay, the first molar is the first permanent tooth to erupt. Okay, so if you see the trauma here, this tooth is a slight out or this tooth is a slight in. But we can definitely make a difference that they are not in the same line. So the trauma has happened in this region. It has happened in the upper lip region, and frenum also is a bit involved. This is the labial frenum, okay, which connects the gums to the lips. The radiographic examination, this is the IOPA which is taken. It shows that these two teeth, 5-1 and 6-1 precisely, they are far from the permanent teeth. So there is as such no danger of the trauma to the permanent teeth, which looks from the present state. When follow-up, it can change, okay? But at present, they are far from these permanent tooth birds. And if you see this tooth, which is 6-1, is a bit displaced, okay? There is a periodontal ligament widening here, right? This is not so widened. However, this is a bit widened. If you see this one, so now we can make out that this tooth is a bit out of level, which we in medical terminology or dental terminology say that extrusion. Okay, I'll be sharing the terminologies once I classify trauma for you. So what is your diagnosis seeing these pictures? Facial abrasions. What is abrasion? When a skin surface rubs against a rough surface like a road. Okay, so that is an abrasion. Likewise, it happens on the facial surface. Intraoral, there are soft tissue injuries on the frenum, on the alveolar region you saw. Subluxation of the upper right primary central incisor and lateral luxation of upper left primary central incisor. So what is the difference between subluxation and luxation? Anyone can tell? Anyone who likes to share? Okay, maybe with our buildup of knowledge, if I ask you the question in the end, you might be able to tell. Subluxation is the tooth has shaken within the socket. It is a bit moved, but it is not moved in the sense of its direction has not changed. Okay, like I'm sitting now, okay, I just go 1 millimeter ahead, you will not be able to make much difference in my location. So this is sublocation. But if I move now, you will all be able to appreciate that I have moved more than 2 to 3 millimeter. So that is the difference between subluxation. It is luxated, it is a bit loose, but it has not changed its position. It's still in its location. Okay, it's still in its home, it's still in its socket. But lateral luxation, it has moved from its original location, its designated location, to it has moved sideways, forwards, backwards, out, or in. Okay, that is all luxation. Now we have the findings are consistent with the history of an accidental fall from a skateboard. But what next? You also saw these things on the patient's face and neck. Okay, so as a dentist, does it are you restricted to just treating the dentition of the child, dentition of your patient, or you would something will hint to you or something will make you uncomfortable seeing this? Okay, in my home country, in your home country, it might be it might be condition or scenarios like mind your own business, do the dental job, and charge the patient money and go back. But in Australia, this is the key difference in the Australian Dental Council exam also. If you are intrigued by something, that this is the condition you are seeing in the child, that means as a healthcare provider, as a general noble citizen or a resident of that country, you should be suspicious about something. And more or all the more, when you are a healthcare provider, you have to take some actions. What actions you would take? What is this? This is some bruises, some petique over the ear and over the back, pinna of the ear. And also there are some marks which are like lateral finger-like marks over the neck of the child. So it does hint that this is the child abuse scenario. And we will get on to child abuse scenario towards the end of the presentation. Now going back again to the signs of trauma, prevalence of trauma. This is all taken from the International Academy of Dental Traumatology guidelines. The soft tissue injuries are the most common, and it mostly impacts the chin, okay, the craniofacial trauma, because usually when a fall happens, this area is most prone to hit the gravity. Okay, this is the outward kind of a thing. And you would notice if you do a survey, or if you see many of the prevalence reports, that's why they have mentioned that most common injuries in the soft tissue happens in the chin. And it is my personal experience also. As a small kid, 5-6 year age of old, when I also hit twice here, and I got sutures in the chin area. So it's very common to fall and get stitches in the chin area, or have soft tissue injury in this region. It may or may not be associated with hard tissue injury. That means may or may not be fracture, maybe there or not there. Then is laceration is the most common thing. Laceration is a cut in the skin. Okay. Hard tissue injury, which is the commonest hard tissue injury, it is head injury. Okay, and it is the most common cause of mortality also. Evaluate all children who have sustained injuries and just refute any chances of if head injury was present or not. Facial fractures have a low incidence in children and adults also. Head injury is more common. But when the trauma happens, it's more common in boys, in the ratio of 2:1. Boys are more affected because they're more, their plays and their sports are more of a physical nature than girls. Okay, so if you boys as a gender, they take start taking far more initiative when in their growing years, in terms of playing around, moving around, crawling around, much earlier than the girls. Okay, mandible are most commonly involved both when the facial fracture happens, and the age range which is affected most is 6 to 12 years. Okay, it's not 0 to 6, it's not 12 to 18. The best, or the not best, the worst age to get impacted, or the most impacted age range is 6 to 12. Okay, up to 1 year, skull and frontal bone are most involved due to prominence. Now, what happens is, as you will also read in orthodontics, Melvin Moss theory and everything, that this area completes growth first. That is the skull. If you see a small kid, the face is small, that body is small, the half of the, like 25% of the whole surface area is covered by the skull itself. So 25% of the area, if it is covered by skull, the impact of the injury happens such that it is the most affected. Okay, skull and the frontal bone, this region, if a child or an infant falls. Later, what happens? Maxilla starts becoming progressive, protrusive, and then fall happens forward. And this area, the maxillary region, gets fractured and most impacted. Now comes classification of the facial trauma. So here I would be clarifying the common terminologies to you so that we are in same page further. Injuries to the soft tissue are of 3 types, basically: contusion, abrasion, and laceration. What is a contusion? Skin gets trauma and a bluish color hematoma happens. That means the blood has collected below. It is called as contusion. Abrasion: the skin rubs against the rough surface, okay, like a road surface. Okay, so that is abrasion. Laceration: teeth cut by a knife-like injury, that is needs suturing. Okay, that is laceration. Coming to location, it's easy to know: forehead, brow, eyelids, nose, cheeks, which is the area which is impacted by the facial trauma. And injuries to the bone. Whenever the injury to the bone happen, open, closed, green stick, or comminuted. Open is the bones have separated. Okay, it got fractured at one end. The one end is other. It's open injury. Closed, the fracture has happened, but they are still aligned together. That is closed. Green stick is just a hairline fracture. The bones have not separated at all. Just a crack has happened. Like you imagine a crack in the glass, but it has not broken. Comminuted, break the glass. It's fractured. Pieces, pieces, pieces. That is a comminuted injury. Location, upper face, mid face, lower face, also known as popularly Leaford fractures. Okay, Leaford 1, 2, 3. Then comes injuries to dentition. That means teeth are impacted or the dento-alveolar relationship is harmed. So this is injuries to dentition. So there was a classification to make it easy, that injuries to teeth, supporting bone is your alveolus, gums, and oral mucosa. Okay. Oral mucosa could be cheek, could be frenum, could be tongue, could be floor of the mouth. Okay. Now WHO gave this classification. I'm not going into details of this classification, and you need not remember also 502.50, all these numbers, they will never ask, but just they will ask questions so that you should know this terminology. Incomplete crown fracture means the pulp is not at all involved. Okay, incomplete crown fracture, the crown is not fractured through and through. There might be just a crazed line, like a glass has that small line, but it's still intact, held together. Okay, so it is enamel infarction and enamel fracture. Enamel can be fractured a bit, but not disintegrated from the tooth. Then comes uncomplicated crown fracture. There is no complication. That means pulp is not involved. It is the fracture which is restricted to enamel and dentine. Then we have complicated crown fracture. That means now complication has come. When complication comes? When pulp gets involved. Okay, it is the life of the tooth. When it gets involved, you will say that it is a complicated crown fracture. Then uncomplicated crown and root fracture. Suppose the fracture happens such that the tooth loses a part of its crown and root, but pulp is not involved. Likewise, complicated when the pulp gets involved in the crown and root scenario. And root fracture when the root breaks into two halves. Okay. Moving on. Next, injuries to the periodontal tissue. Concussion, subluxation. Again, need not remember all this. I'm going through all the terms so that you have revised what the terminology of trauma is. So subluxation and luxation, I introduced when I showed you the beginning, the picture of the child. Subluxation, it's just in the socket, but a bit moved. But intrusive luxation, extrusive luxation, lateral luxation, these are all the terms where the tooth has moved. Intrusive means it has gone inside. Extrusive means it has come outside. It's a bit hanging. Lateral luxation, it has moved either buccally, palatally, mesially, or distally, right? What is their concussion about? Concussion, if you see, there is no mobility. Subluxation with mobility. So concussion, as we say, the term itself means the tooth is shaken within its periodontal ligament area. Within its socket, there came a jerk and it has shaken, but it's still holding strong at its place. So related to the word brain concussion, okay, if somebody gets a fall, that person would have that head spinning for days together. That means within that cerebrospinal fluid, the person has felt that jerk. So this is called as concussion. But the brain is still in the same place. It does not, it has not moved from even, 1 millimeter, 0.5 millimeter from its place. So that is the difference between concussion and subluxation and any type of luxations. Hope I am clear so far.
Yes, clear.
Okay, great. Now, again, going back to my clinical scenario, 6-year-old child. If you see, now explaining one more thing between concussion and subluxation. In the radiograph, in the clinical picture, how will you differentiate? Concussion, there will be no movement at all. Okay, but In subluxation, periodontal ligament widening will be present. In luxation, the tooth will be out in side ways anywhere. Okay, so that is the one more difference I wanted to highlight between concussion and subluxation. Then this is again WHO classification, injuries to hard dental tissue and pulp. Again, showing you the pictures. This now we can talk very easily about them after knowing the terminology. This is what? Intrusive luxation. The tooth has gone inside. This is what? Extrusive luxation. The tooth has come outside. Okay, so this is inside. When it has gone, the tooth hits the bone, right? It crushes the in-between periodontal ligament. Okay, so it has gone and crushing the almost the bone. So this is just the pictograms describing this. Then injuries to the supporting tissue, where crush of the alveolar socket has happened, okay, or fracture of the alveolar socket has happened. This can happen with when the dentist is not doing the extractions also properly. That is also one of the cause of injury to iatrogenic damage, what we say. So if you don't hold the forceps at the correct location, that ADC checks in the part 2 exam, right? So if you crush the alveolar socket, if there is a fracture to the alveolar socket, that is one type of trauma. Fracture of the alveolar process, when alveolus plus the upper gum region, the whole thing forms alveolar process. Okay, so it always happen usually with luxation. The side where the tooth is moving, it gets crushed, it gets fractured. So suppose if a tooth is moving, if a person has suffered a blow and the tooth is moving back, the back side, the palatal side of that alveolar process will get fractured, right? Then fracture of the mandible or the maxilla in itself. Moving on, injuries to the oral mucosa, again, laceration, contusion, abrasion. These are the same terms which I explained for the skin when it happens to the same thing. Applied to the oral mucosa are given numbers by the WHO classification. So again, repeating, need not remember the numbers, but do remember so that you know the English terminologies of all these traumas. Now, treatment principles. As a dentist, when a patient with coming to you with carrying any type of trauma, okay, it could be contusion or simple soft tissue injuries, dentalo-alveolar injuries. One important tip is that ADC is more focused on asking dento-alveolar and dental injuries trauma. Hardly they ask traumas which are facial fractures or craniofacial region. Why you think so? Because it is a test exam to test the skills of a general dentist. So suppose if somebody has fractured the face, gone for a greater trauma, okay, so that person would be already admitted to the emergency services in the hospital. He would directly go into the care of oral surgeons, okay, but the dento-alveolar traumas will reach the dentist, dental clinics, okay, general dental practices. So that's why what scenarios a dentist often sees in the clinic are asked in the exam more. That's why the dento-alveolar trauma will be asked. It's every time in the exam you would find minimum 10 questions, okay, out of trauma, minimum. So we will, because it's easy to frame scenarios on traumas. In one picture they will show you 2 teeth traumatized. One has gone in, one has gone like in the picture just I showed. So it's easy to ask questions based on that. Then comes the first principle. Now ADC is fond of asking what would you do next. They will give you a part of the stem and will ask you what is your next step, how you would take the next reasonable action. So airway establishment and maintenance. Suppose a person has suffered any dental trauma, airway is ABC. It is given anywhere in the history or in the history, pharmacology, physiology of any healthcare management, CPR services, A. Okay, everything starts with airway. So airway should be potent. Okay, it should be patent. Now you have to ensure that airway establishment is there. Obviously, again, repeating that this usually would be intact, but in case questions can be framed that they want to know this. So this is the first thing, patency of the airway. In case airway is not patent, the last resort for any healthcare provider is to do tracheostomy, open a hole here. Okay, if their choking body is not able to come out or whatever, the first thing is CPR services, that is removal of the choking body, whatever has, suppose a tooth came out in trauma and gone back. Okay, the child was not able to regurgitate the tooth out and it has gone into the neck. The first is the CPR and creating the airway establishment. But in the airway establishment, the last resort is tracheostomy. Then in the history taking, you have to ask subjective complaints. Why, when the mother said that the child hit the skateboard, hit the ground, and the child fell in the neighbor's, was playing in the neighbor's area, you have to ask, did the child lose consciousness? Did the child felt giddy? Did the child vomit? Was there any headache? That is to rule out any head injury. So that is the prime refuting it out. If something you think or it comes to you that it could be a chance of head injury, direct referral to the emergency services, right? You are not picking the instrument also and examining the mouth and whatever. You are directly referring to emergency services. Then any history of spontaneous pain from the tooth, usually it would be yes, or maybe it would be numb at the time of injury. Reaction of the teeth to thermal changes, sweet or sour food, which will be our vitality tests indicating also. And these are subjective complaints. This means they will indicate you, they will be told to you by the patient themselves in their own language. Then comes what are the signs of neurological involvement. For the completion, I have listed them out so that when you receive this document or the PPT, you will be able to remember. It's loss of consciousness, altered mental states, blurring of vision, headache, vomiting, loss of smell, taste, hearing, sight. Any senses basically lost for a while is a sign, can be a sign of head injury. Discharge from nose, ear, any seizures, dizziness or drowsiness. Then comes tetanus protection protocol. When you are taking the history, you have to ask, where did the child fell? When did the trauma happen? Okay, how much time has lapsed since the child is reached your clinic and since the trauma happened, right? And whether the child fell on a dirty floor, whether it was a muddy floor, it was a playground, or it was a clean home floor. So that is a lot, that makes a lot of difference in your tooth treatment protocols also. If suppose the child has fallen into a ground, one thing is that the trauma also changes. Suppose a child falls on a playground. The playground is very resilient. Okay, it's like a softball hitting versus falling on the hard floor. It's like a metal ball hitting. So the trauma in the playground might be the tooth comes out, but on the hard ground, it would be the tooth fractures. Okay, so we would, what kind of trauma happens also depends upon what is the impacting object strength, hardness, resiliency, right? Then regarding to this dirty surface or a cleaner surface, relates to, or it gives the prognosis of what would be the tetanus requirement for that child. Immunization, you have to ask if it's a child patient, and even in adults, it is an imperative question, because we must know that very young children, usually the tetanus, it's everywhere in all the countries now. Tetanus by WHO vaccination is quite strengthened. So mostly all the children complete by 12 months of their age, 1 year of their age, DPT vaccines or tetanus vaccines are done through. Immunization completed. So booster, if the children have taken within 12 months, no additional toxoid is required. That means if the child has got trauma yesterday and the child has had booster in the last year, there is no need for giving any additional toxoid. But immunization which has been completed within 10 years, 0.5 ml of toxoid needs to be given. I'm sure you all must be having your 10 years annual, within 10 years, as a dentist also, we should be tetanus protected. So within 10 years, we should be getting the tetanus immunization again, 0.5 ml just. If it is more than 10 years, 0.5 ml of toxoid to be given. Completed more than 10 years, no booster dose, again 0.5 ml, and no history or record of immunization. If you do not have the record, clean the unit, clean the wound nicely, and give 250 to 500 units of tetanus immune globulins. That is the passive, you need to give the passive immunization, or 0.5 ml and 0.5 ml of tetanus toxoid. Then comes history again, how, when, where, and who was the witness. Witness is an important question when we are trying to deal with children. Who saw the trauma? That would also help you disintegrate whether this is a case of child abuse or a violence between the kids. Even the sports violence or the violence in the school, it has to be reported or it has to be brought out. Sometimes the parents would not be aware of it. So when you ask these probing questions, they would get to know, okay, sometimes the things are not brought out or charted for them also. Any history of allergic reactions to the child, it is very, very important for you to plan ahead medications as well as the treatment. Any history of bleeding disorders, if the child is having any history of bleeding disorders. What are the type of bleeding disorders? Anyone? 2 types broadly: bleeding disorders and disorders of coagulation. Right? So hemophilia is a type of...
Assalamu alaikum.
Yes,
Acquired and
Baba.
congenital.
Okay.
অ্যাকোয়ার্ডের মধ্যে হচ্ছে হিমোফিলিয়া, কনজেনিটাল হচ্ছে থ্রোম্বোসাইটোপেনিয়া, liver disease,
Great.
and
Very important.
Madam, you can tell me English. You don't use Bangla.
See, bleeding
Some don't
disorders,
understand
you mentioned hemophilia is correct. Okay.
Mhm.
But coagulation disorder, liver disease is correct. Thrombocytopenia is a bleeding disorder. Right? Then history of asking cardiac diseases. If the child has cardiac disease, that means infective endocarditis prophylaxis needs to be given. Okay, so it is a very important history. The child has got trauma and there is an open, so you have opened or not, trauma has opened the source of infection. So antibiotic prophylaxis, amoxicillin, stat needs to be given to the child. Then you have to ask questions about the general health. In this case, history, the history was clear. The child is medically fit and healthy. Then comes, this is all your forms a part of your history. And again, if you are doubting physical abuse of the child, you have to take history and also not just think or see for the objectivity of what the child or the parent is saying. You have to mentally, become like a criminal case, like kind of a recorder there. So you have to assess what are the mother's expression when the child is giving. Is the child is too shy or not opening up? Is there a chance of mass abuse over the child? Is it a stepchild, or is it? You have to frame in kind of a plot. Can there be something which is really unsafe for the child? And then we will get on to framing it, and in the last slide I will show how to report it or not report it to the for the child abuse case. Now, going to science of traumatology again. So you will the first step is clinical examination, extraoral, intraoral. The next step is palpation. Obviously you will see which tooth is shaking, which tooth is intact. So that is palpation. Percussion with the back of the mouth mirror. Okay, you will percuss the teeth. Vitality tests. If the tooth are cracked, okay, so enamel dentine fracture has happened, so you will do vitality test. Now, vitality tests are the baseline tests you will record, and we will see the health of the tooth over the time. Okay, so baseline recording at the time of trauma, what were the tests of cold test, heat test, electronic pulp test, what were they conveying to you? Then very important are radiographic evaluation. So always remember this sequence, because ADC might ask, what is the next step you will do? Okay, suppose they have got the patient and it is already done till percussion. Your next step should be vitality test. So that answer can change depending upon how much question they have already framed it. Radiographic evaluation and emergency care of the walk-in appointment. That means if the tooth is fractured, you have to give that emergency care at that appointment. Now comes clinical examination. So this was the clinical examination and the emergency care, but in clinical examination, what all to be seen? Okay, so extraoral signs of injury, swelling, color changes, hematoma, bruise, petechiae, okay, blue color inside the skin, or facial asymmetry. If there could be a fracture which is leading to facial asymmetry. Facial bones and mandible should be palpated. Okay, we palpate individually this orbital bone ridge. This is the whole maxilla, and we also palpate mandible, right, to check and check the continuity of the whole of it. Okay, there shouldn't be fracture in the orbital rim. There shouldn't be fracture in the zygoma. There shouldn't be fracture in the mandible. Okay, here, and then you complete the examination in the coronoid and the condylar process by checking the TMJ. Examine all the teeth. Okay, look for fracture pulp exposure. Record the displacement or subluxation injury, and do pulp vitality tests. Inside the tooth, inside the mouth, the clinical features: pain is a symptom which the patient will report. Swelling, you will be able to see the swelling. Disfigurement, discoloration, any tooth which has got missing, any broken tooth. Clinical feature: anxiety and psychological shock are also important clinical feature which you need to write down in your case history when you are extracting information, clinical information gathering from the patient. So this is all clinical features. Then comes radiographs. Radiographs serve as a baseline record. They also serve as your medical legal record. They help in follow-up. What will happen, how the tooth health will progress or deteriorate. They help in us assessing size of the pulp chamber, any periapical radiolucencies, stage of the root development for young permanent teeth, or the primary teeth which are developing or which are shredding. Degree of displacement of teeth. Sometimes clinically it's we cannot make out astutely because of the blood and other factors, but we will be able to directly see with the degree of displacement of teeth in trauma, and the three-dimensional movement, right, of the tooth. So we will be able to see much more clearly with the radiographs. Then you should be able to see any tooth fragments, any fractures which has led to a small tooth fragment being there, presence of root or alveolar fracture, which is maybe the tooth looks fine outside when you are checking, but only through radiograph you will see inside the root is fractured. Then you have to ascertain position of the traumatized tooth. Say it could be a primary tooth, so that you have to see how far or how near it is to the permanent tooth. Then any pre-existing pathological condition. Okay, if the tooth was already having the, say, amelogenesis imperfecta, it was more prone to fracture anyways. Then the dental trauma guidelines say that no standard series of radiographs they have advised for the dental region. The choice depends on case-to-case basis and the region involved. So if it is an anterior fracture, they recommend to take radiographs in two views. So one is IOPA, other could be occlusion. Okay. For children, sometimes they are not cooperative. So if the child is not cooperating with IOPA, the child is gagging a lot and child would already be in pain, it is recommended to take the IOPA film and take an occlusal view. Okay, so this is how radiographic guidelines by dental traumatology says. Then there are some general recommendations by these guidelines. They say that special consideration for trauma to primary teeth. Primary teeth are to stay for a short while, okay? And we go a bit radical in treating them. Suppose if a primary tooth has come out, it has got avulsed. Do we reimplant? No, never. Because we don't want the tooth to go back and block the eruption pathway of a permanent tooth. If it can get ankylosed, it will block the eruption pathway of a permanent tooth. So we have to see primary teeth and also their relationship with the permanent teeth. If the primary tooth has got and hit inside the permanent tooth, we need to do active something so that the permanent tooth way is cleared when it's time for its eruption. So in fact, one of the guidelines is solely directed to primary teeth. So guideline number 3, there are 3 sets of guidelines, 1, 2, and 3. So 3 is all set for primary teeth only. We will cover that for those who will join us for the course separately. Then we will see immature versus mature permanent teeth. Okay, immature versus mature means root has complete or not. Avulsion of the permanent teeth, the tooth which has come out, okay, it has to be implanted within. So this is an important feature. On it, IADT has given a precise guidelines how to manage avulsion, which would be too extensive if I try to cover today itself. So I am just covering the glimpse of the overall teaser of the trauma for you. And patient and parent instructions, having a soft diet, maintaining the oral hygiene, using chlorhexidine mouthwash or chlorhexidine, paste for children if the child is not able to apply by himself. So these are all patient instructions, and also anticipatory guiding them what else can happen. So in 2 months, the tooth can turn blue. In 2 months, the tooth may turn, more shaky. Maybe the resorption starts happening. So you have to preemptively tell the patient or the patient party that these can be the follow-up or consequences of this trauma. It is looking fine for now. It may turn dead. Today it might be painful, but after a while, after that shock stage is over, the osteoclasts or odontoclasts can become active and they may resorb the tooth in itself. Okay, so you have to give a kind of detailing to the patient, and questions can again be framed on this, that what all will be the anticipatory guidance you would have to give to the patient or patient party. Then I'm covering a small bit on the last two slides will be on injury to the periodontal tissues and crown and root fracture. So this is about splinting. Whenever the tooth is subluxated, luxated, we need to, in subluxated, we need to give it a rest and sometimes splint it so that it doesn't shake more. In luxation, we need to take it to its position and again splint it. Okay. So, and crown root fractures also, it needs to be given immobilization. Now the crown and root suppose has fractured over here. So if you splint it, it will become immobile. Okay. It's like giving crutches to that tooth. So it will stay immobile with the help of the other two teeth, other 3-4 teeth in the arch, and that will allow healing to happen. That's how when the bone fracture happens, the doctor gives us plaster so that it stays immobile. Okay. And there is a blood circulation created around that wound and the bony union happens. Likewise is for the tooth movement. When we immobilize it, splint it, it gets corrected. So these are the names of the splints which can be used. The most commonly used is the orthodontic wire and composite. Okay, arch bar, arch wire, arch bar and all are for facial bone fractures and all. Okay, so this is all the names of the splints. Splinting duration, very important part. If you notice here, this is 2 weeks, 4 weeks and 4 months. So I always, there is a small tip and trick to it. You remember 4 months is only for the root fracture, which is happened at the cervical third. Now cervical third, see the root is inside in the maxillary alveolus. Okay, one more important point, the trauma usually happens to the upper teeth more. Mandibular teeth are usually shielded. In my whole career of 10 years and 5 and 3 years of BDS and MDS and almost 18 to 20 years of my career, I have not seen much of the mandibular fracture happening because of the trauma. Whatever mandibular teeth fracture happens, it's because of the tooth pin injury, the ice crushing injury, all these tiny injuries. But fall kind of injuries, and this has more propensity in the maxillary region. Again, the prevalence slide. Now comes root fracture. If it happens at the cervical third, it needs the greatest period of splinting, which is 4 months, because the tooth, you imagine, is just hanging. It doesn't have any anchor to it. So it needs longest time of union, and the prognosis of this type of fracture is very weak, very low. Okay. Then comes, you remember the 2 weeks ones, okay? Subluxation, extrusion, and avulsion. Just 2 weeks. Subluxation, where the tooth is just shaky but not moved from its position. Extrusion, when it's a bit out, you just have to press it in and hold it for 2 weeks. Avulsion, tooth was completely out. You have planted it back and given it 2 weeks of splinting. Rest all injuries are 4 weeks. Okay. In primary dentition, when you see these root fracture and lateral luxation, if splinting required, what does it mean? It is guided by whether you would want to treat that primary tooth or remove it, whether you would want to remove, whether you want to fix it. The downplay of treating primary tooth is it can get ankylosed. It can create resorption inside the bone, which is far more hazardous than removing it preemptively early and let the way be open for the permanent tooth to come. We may give a space maintainer later on. Okay, so just that's why they have completely written and highlighted this point in brackets. If splinting required, if required. Here everything is required. There is no question of if. Okay. Subluxation is if, because we may choose to just ask patient to go on soft diet. We may need not splint it at all. It might be self-healable. Then comes, this is the permanent dentition follow-up regime. It's more or less have to go for memorization of it. We would go to it in, we can share some tricks and tips with you on memorizing the same also. But the permanent dentition injuries are vast, and this is how where splint, where radiograph advised, and how much would be the follow-up. Now, this is my last slide when it comes to the completion of the today's case. Now, child abuse signs, okay? It's a very complicated area you have entered in. Now, you have to use not just what answers the child or parent is giving, but you also have to use your other senses. You feel something is mismatched. The mother is not watching at you, is not having the confidence to look at you while the history is being given. And the history and the signs of injury are not tallying. If the time of injury and their presence, they are changing their stances. So that means it's a child abuse relatively, okay? Now, you have developed concerns about child's welfare. What are the next steps you will do? You will assess the child, history examination, talk to the child, and discuss with experienced colleagues. Get other colleagues on board, okay? So that you don't overthink and overrun scenarios in your mind. And if you have, remove your confirmation bias. Get it confirmed by somebody else who also gets on the page. Okay, yes, I also think so. And examples in Australia, where to go for help. Local Safeguarding Children Board or Child Protection Committee procedures. These should be documented on your clinic's walls also. Safeguarding Children Advisory Service telephone helpline should also be there. Consultant pediatrician, whom you have a tie-up with your clinic. Child protection nurse, children's services or social services, an experienced dental colleague, and any other child's health visitor, school nurse, or general medical practitioner. If you don't have concern, please proceed with all the, dental, your delivery of the dental healthcare provider work. Provide the necessary care, do all detailings of the records and follow up. But if you still have concern, again, it will go into two parts. Action needs to be taken immediately, but you have to be smart enough to think in the child's best interest, whether, Australian guidelines say it is best to talk to the parents and ask them that it's in your best welfare that we will arrange a meetup with child health services. And this is what we think, child abuse. But sometimes if you think that child might be more victimized, then you behold that information and you would have to go about it in a different way. That is not taking parents into confidence for the best interest of the child's welfare. So action, what is needed immediately would be provide urgent dental care. That's your job. Whatever is to be done, done. Talk to the child and parent, explain your concerns, inform your intention to refer and seek consent to sharing information. This is, if you do not think it is safe for child, do eliminate this step. Refer for medical examination if necessary and keep the full clinical records. Then call the services with 48 hours, take further action. Later on path would be confirm that referral has been sought after, the patient parents have taken the child to those services, and again arrange for your dental follow-up based on what kind of injury was it. So this is so important. The Australian Dental Council exam has in clusters, okay? In one of the clusters is health promotion. So this also falls under a big job of a healthcare provider to not just sit as a dental mechanic or a dental technician and doing the dental job only, but you have our full ownership or onus of the healthcare of that patient coming to your doorstep relies with you. So that's why it's an important part which comes as a part of bracket of the trauma. Again, I'm bringing some pictures that a dental trauma will not come to you as trauma, but these are the life of the patients who would be suffering with this kind of a fracture, pain, soft tissue, bruises, injuries. This is a furthermore fracture, okay, which we say as a pulp has just a pinpoint exposure. All these injuries, their treatment plans are now the guidelines. If you read, you will be able to understand much better. Those who are continuing the course with us, we will take you through them. This could be the fracture. This is a community kind of a fracture, all thrashed through. Okay, this is the tooth has come out, avulsion or X articulation. That means in the tooth was in articulation X, now it has become X. So replantation of this tooth and again splinting and the protocols required for it. So the patient comes to you in a very distressed and diseased state. It's up to you how you render your treatment and bring the best smiles back to your patient. So that was it for the content part of the masterclass. I open the room for discussion and more interaction with you on the topic.
Yes, guys. So now, thank you, Ankita. So if you have any questions, you can ask to Dr. Ankita. And if you have any in general questions also, I'm also here. Mehbubul Islam, he is performing some,
Yeah,
procedures.
he's already with his patient.
Yeah. Yes. So, guys, can I ask you a question, a doubt? And otherwise, we have given this one of the form in the chat box. You can fill it this, and we will get back to you. And if we have in future any information or any update, we will send it to you on your email, on your WhatsApp. Please
Yeah,
repeat the question.
Sushma has raised hand. Hi, Sushma. Can you please unmute yourself and ask the question?
Hello, ma'am and sir. It was a good lecture. Thank you so much. I'd like to ask you whether both the theory part and the for practical exam, we will be prepared for both. Will we be prepared for both by your academy?
Yes, we will provide ADC part 2 later on, but right now we are offering ADC part 1. Okay.
Okay, so
Yes.
they are on different schedules.
Yes.
Okay, once we clear the part 1, you will. Okay, all right, I got it. And what would be the cost of it, sir?
Yeah, you can just, as I mentioned, since the form is given in our chat box, so our team is guided to you. Right now, we are giving some offer in scholarship. We also provide the loan facilities. So there is so many. So you can just maybe you can provide your phone number, email in our chat box, or you can fill this form. So tomorrow morning, our team will get back to you.
Okay, all right. And all the faculties will be teaching us, or one faculty would be teaching?
No. There is a 3 to 4 faculties.
All right. Okay, thank you so much. I'll leave my phone number and the mail ID in the chat box.
Yes, please give your name and phone number and your WhatsApp number. So we will connect you shortly tomorrow morning.
All right. Thank you so much.
Thank you. Yes.
Dr. C.C. Abraham.
Okay. Good afternoon to everyone there. It's an afternoon over here, and my concern is about the time. If I subscribe to the membership of Academy, what times will be the classes be going? Because I understand that the time difference in my place and where you guys are heading.
Okay, this is a good question, because we are a global academy. So the students are from like around 55 countries join us. Okay, so we provide live class and we record those sessions. So if you miss any class, you will get the recorded session. Okay, but in general, we will follow the. What was the time for Ankita? Arindam is there?
Okay, we are holding weekend classes. Saturday, Sundays, there would be classes because mostly Saturday, Sundays, most preferred choice by many candidates weekends. Apart from that, there would be 2 to 3 days of weekday classes, which would happen in the evening time of, say, India time. It would fall around 5:30 to 7, or maybe 7:30 to 9. So that would be depending on, again, a poll of your preference of how many candidates want that particular slot. Also, as Dr. Akram mentioned, that all the lectures will be playing on your portals. You will have the access and unlimited viewing, watching, unlimited seeing of the material till you pass the exam.
Okay, thank you.
Thank you.
Yes, Dr. Tatiana.
Thank you very much for your presentation. I want to take the exam at the end of 2024. It's possible to give me some advice how to start studying from my country? Maybe where can I find the guides?
Okay, so your first step would be initial assessment, and yes, so you would have to send your practicing license, your references, your 2 referees you will need to write for you where you are practicing, and you have to submit all that information with around 600 Australian dollar to ADC. And that after you have got your profile photo, that will be captured by them, and you would also need to submit your basic passport and the your genuine verification document. Once your profile gets ready with them, you will be ready to go for application period of the next written examination. So if you have a plan to give it in November 24, it's a high time you start your initial assessment part. Please get in touch with the Academically. We will help you go through that.
Thank you very much.
I think you can please give us your phone number, email in the chat box. We'll connect to you separately.
Yeah.
Okay, thank you.
Dr. Hiren has a question. Hiren Dayani.
Hello, ma'am.
Okay.
So
Yeah,
I tried to.
you were using your this one.
Yes. My name is Namrata. Sorry.
Yes, okay.
So I tried to submit all the documents for the initial assessment, but that time, like I think for the dental syllabus, because it's a big file and I couldn't upload that big file, so I don't know how to.
You can reduce the size, okay, or contact us. We will also help you. No need to worry. All these steps we can help you, or maybe you can just compress the file. You can reduce the size of your file, and you can submit.
Okay, thank you.
Thank you. Please give us your phone number, email in the chat box. So tomorrow morning, our team will connect to you and try to guide you. And in future also, we are going to conduct several other like master classes. We may send you the invitation again if you are interested to join us. Yes, Dr. Fazana.
Excuse me, sir.
Yes, Dr. Fazana.
How to get admission in your academy?
Yes, आप अपना phone number, email you can give and share in our chat box. और यहाँ पे एक फॉर्म दिएगा, उसको अगर आप फिल कर देंगे तो we'll get back to you. Or basically, I mean, you receive this link through a WhatsApp, right? So in that same WhatsApp, you just say hi, and the guy will respond to you.
Please fill in the
Okay,
feedback form, everyone. I request you again.
Push receive the full number drop का number or email same.
Okay, thank you. Yeah, Dr. Farsana.
Hi, sir. I am Farsana. I'm graduated from Kerala University, and
Okay.
I have registered in Kerala Dental Council. Do I need to register in Indian Dental Council?
No. Kerala Dental Council is a state dental council, and there is no such thing as Indian Dental Council.
Okay.
So it's like state dental council send the reports to ADC directly.
Okay, thank you.
Thank you. Yes, Dr. Suraj.
Hello, sir. Hello, ma'am. It was an amazing presentation. It was very informative. Ma'am, I just wanted to know if I want to give my ADC exam in March, will I be able to do it because I haven't done my document verifications now?
Well, initial assessment date has passed. So it was on October 18th.
Okay.
But still write to ADC, let's see. It
Okay.
could
Okay.
be. Usually don't.
Possible. Yeah.
Usually they don't shift from their rules or whatever is given. It's black and white. But yeah, you would be maximally able to make it in the second half of 24.
Okay. Okay. Thank you so much.
Right. Who knows what reply you get.
Yeah.
Okay, ma'am. Thank you so much.
Just try to submit as soon as possible. Sometime they may consider if there is not many
Yeah.
applications are submitted. Okay, so Dr. Suraj.
Okay. Okay, sir. So should I contact some of you to help me with that
Yes,
guidance?
we can help you. Yes, you can give us your phone number, email in the chat box. Tomorrow morning, our team will connect to you.
Okay, fine, sir. Thank you so much.
Thank you. Yes, Dr. Samia, please don't share. This is private, basically, this.
You can unmute yourself and ask the question, please.
Yes, anyone, please ask your doubt or any questions.
Hi, Doctor. I'm Dr. Desmond from Malaysia.
Okay, Doctor.
Malaysia. Okay, you are in my country, my present living country. Yeah.
Yeah, I'm from Malaysia, Penang. So I'd like to ask if I'm prepared to sit for the October examination, when is the submission deadline will be given to us for us to do the assessment, initial assessment?
So they are going to open basically, I think, the new red line. So they just pass for the March one. Okay, but you can submit, as soon as possible. So don't wait. Please do not share, Sumaya. Someone is here. Tausif. Yes. Okay. So maybe you can type your question in the chat box. We can read and give the answer if you are unable to unmute yourself. Yes, Dr. Roy, any other question? Parsana, do you have any other question?
So I'm sharing just a brief information for you all in the chat box.
Yeah, so 24th April. Okay.
So for period 2, initial assessment deadline would be 24th April 24. So it's high time you do the initial assessment now for 24 end period, and that will help us in
But you can start preparation now onwards.
Yes.
So you will get at least 2 times you can prepare yourself. We will give basically unlimited access for you. This is our we provide basically for everyone like this. So you can join now. Instead you are waiting, so you can at least start preparation, and simultaneously you can we will help you to apply your ADC skill assessment are done.
Can we do job of dental assistant after part 1? Mohammad Amar Syed doctor has asked is, well,
yes, you can.
Job dental assistant in Australia, it depends on if you hold a valid work rights there. So if you hold a valid visa, you can definitely do a job of dental assistant.
Yes. So if you have your own visa, for example, and if you pass ADC part 1, you can work in Australia as an assistant. For example, you are on any dependent visa, for example, or any other visa, or might be the company sponsor you something in that case. Otherwise, you have to go to this part 2, then get the work visa, and then you can start working.
Dr. Usman Sardar, you're getting late. I understand that. Regarding the whole discussion, you can get back to us. You can write your concerns and
Dr. Usman, basically, this is on live on YouTube.
Yes.
This is we have one YouTube channel, Academically.MedPrep. Okay, this is a dedicated channel for AMC and ADC. You can go there and you can watch this whole recording. Yeah. Or maybe you can provide us your phone number and email. We will get back to you. We'll give you the all information. We can give you the link also here.
Dr. Rubaba, do you have a question?
Yes.
I'm Muslim
Hello.
from Dhaka, Bangladesh, and I'm
Okay.
studied in Dhaka Community Medical College and Dental Unit.
Very
I have
nice.
just appeared in the final professional exam, and my result will be published on probably last week of November.
Okay.
So, can I apply for AD exam for part 1 in my intern time?
No, you should be having the registration in Dhaka, in Bangladesh first, so that you will get after your internship. During internship, you won't be able to apply.
Okay, ma'am.
Registration is mandatory basically.
Internship is the best time to get into the preparation. You are watching patients, you are doing clinical procedures, and side by side, you are.
Yes, ma'am.
Okay.
Thank you, ma'am.
Okay, Dr. Akram has shared the YouTube link where you would be able to re-watch the presentation and the doubts, the question and answer round, whatever those who want to re-go through it. Dr. Roshni.
Excuse me, ma'am. I want to ask one question. Like, what is like the classes? The class which we had today was very good. Like, so are we having those kind of classes in the coaching, or how is it going to be like every subjects, or how is it going to be like the
Yes.
coaching classes?
My
Yes.
classes will be like this. So whatever coaching will be there
yes.
with the ADC plus clinical case scenario. If you have any doubts from the basic, you need not be very at all hesitant. You can ask 100 times, 100 questions, and you will never be judged. You will never be asked what you have learned in dentistry. I'll teach from the perspective of you are my young brother and sister and learning the dentistry through the eyes of Australia now. Okay, so
It means, ma'am, we'll be having slides like the clinical slides, and we'll be discussing about that in the coaching classes, not the theory part as such.
yes, we
Is
will
it?
be having a mix of definitely theory would be needed. Memorizing of what ADC expects will be in your hand. So we will also be giving you materials to read by you. However, the classes which I'll be preparing and sharing with you will be all case governed so that it won't go dry.
So, ma'am, one more question. Like in the ADC exam part 1, is it like we have to write like there will be explanations or something, or is it like just the MCQs type?
Okay, it's a very important question, Roshlin. For everyone here, I would want to answer this question by taking some time. So they are all MCQ. Okay, but our definition of MCQ, as I did my undergraduate and prepared for my postgraduate entrance exams in India, was there was one correct answer. Okay, so if this thing, suppose in a child with a renal disease, which drug is contraindicated? So there would be only one drug which would be given in the list. Rest 3 will be correct. Only one will be the correct answer. Rest 3 will be incorrect answers. But when it comes to ADC, it's single best answer MCQ. That means for the question, there will be a clinical scenario. A patient comes to you with trauma, okay, walks into your clinic. What you will do next? Now, next is everything you have to do. You have to do palpation, you have to do percussion, you have to take radiograph, you have to comfort the patient. But what is the first step you will do? So that ADC expects it's all correct answers, but one best answer. So that is the very tricky thing in ADC exam. It is in the framing of the questions, it is checking your knowledge and application as a performance of the dentistry. And it's not checking brutal questions of anatomy, where does which foramen maxillary nerve passes through. So ADC is really not concerned about that. But yes, while giving LA, which nerve you are pricking, where how can hematoma happen, it can create question on that, which passively checks your knowledge of a performance of a clinician, but not direct pathways, direct dosages, direct stuff. Right?
And one more question, ma'am. Will this, like the coaching classes only be enough for us to pass the ADC Part 1 exam? Or do you have to like study our books and all the theories which we studied in our dental years?
Well, there is massive dental course in itself is a massive 5-year course. Okay, 4-year plus internship, or some places 5-year course. But definitely every exam, every licensing exam has its own favorites. So you will be guided to cover only the favorites of ADC. Definitely they are not asking, we will guide you what can be just a passing information and what is the key focus information. So suppose they are not asking how many millimeter will be the FPD preparation. That they will check in the part 2 when they ask you to directly do it. So it's you will be guided on to what things to be read from where.
Okay, thank you, ma'am.
Thank you. Yes, Dr. Pamela Francis.
Hello, good evening. My name is Dr. Pramal Francis. I'm an orthodontist, and I've been working in Saudi Arabia since 4 years. I'm 7 years experienced orthodontist. I would like to know, once if I clear my ADC part 1 and part 2, will I be able to work there as an orthodontist, or do I have to do any additional like studies or any other stuff over there in order to practice as an orthodontist?
So Dr. Primal Francis, it's a general dentist licensure examination. So after clearing ADC, you will be able to only work as a general dentist there, and you would have to refer patients to the specialist orthodontist of Australia for the while you get your specialist license ahead in Australia. So so I'm also a pediatric dentist in my home country, but this exam just gives me license to practice general dentistry.
So in order to work as an orthodontist, what do I have to do? I didn't get it clearly, please.
So you would have to do masters in Australia.
Yeah. Fine, yeah.
After clearing the licensure.
Okay, so I would have to do 3-year studies there and then get the clearance exam done for practice as an orthodontist.
Yes, there is no master's licensing equivalent examination in Australia. You would have to do the course, master's.
Okay, fine, got it.
One thing is there, you can always do Invisalign and all these, which are, I think so you can, apart from the fixed orthodontics, you can do.
Okay.
I'm sure
like
you can do it.
kind of like basic ones, right?
Yeah, basic ortho treatments you would be able to perform. But other when like the core masters fixed orthodontics, that is out of scope of a general dentist there.
Yes, okay, I got it. All right, thank you so much.
Thank you. Yes, anyone else? Any questions? Or we can bind up. Dr.
Hi,
Shashank?
sir.
Yes.
Hello, sir.
Yes, please.
You have reported that for initial assessment, 600 Australian dollars should be paid. How much for written and practical examinations?
Written examinations is 2,060 Australian dollar as of present. Practical examination is somewhere around 4,600 to 4,700, 4,650 Australian dollar. Part
Okay,
two.
thank you.
Prathama, you can go to our website and we have a lot of blogs, related to the ADC. So you can go there, you will get a lot of information, in order to apply now.
Okay, thank you, sir.
Thank you.
But one step at a time. If you start calculating the whole cost at now only, you will never be able to put the feet in the testing waters.
Yes.
Go in installments, get initial assessment done, which is valid for some 5-6 years, then make mood for start preparing for written examination. Pay for it when you think, okay, in the next 6 months, I'm ready to hit it. So that's how I did. Otherwise, it becomes very overwhelming.
Yes, Ritik, can you please give us your phone number and email in the chat box? I mentioned that there's a scholarship is ongoing for a ADC program from Academically. So our team will get back to you. So you just provide us your phone number in email in the chat box. We will get back to you. Yes, Dr. Insaf Mohammed. Yes, Nisi.
So, what about the part of coaching? We can't do online, right?
Dr. Insaf, your voice was breaking. Request you to repeat.
I think he's asking the coaching. So yes, we provide online, right? You are asking coaching only, right? So this is an online coaching. You can access on your mobile phone or laptop or desktop, whatever you have. So we'll provide the live sessions, live classes, plus we will record it. So if you are in working with, for example, you are not able to attend the live session, then in that case, you will get the recorded session, the study material, then lot of mock tests also will provide you.
Dr.
Okay, thank
Naisi?
you.
Nisi?
Dr. Naisi, do you have a question?
Part two and giving exam, we have to come back again, like if I'm in India, I have to come back again to India and work for a year.
I think Dr. Nisi is asking regarding the part two. So this like that skill assessment you can do in India. Part one also you can write in India itself. English test also you can write in India. But part two you need to come to Australia. So if you are coming on like on a visit visa, then you have to go back because this visa is just for visiting. No work right to work. So once you pass, then you have to apply the separate visa.
Dr. Abdullah Babar Khan has mentioned a question in chat. Does UK BDS graduate have to give an ADC as well? Okay, so depending upon the university and your registration in UK, you might not have to give ADC exam. It just needs equivalency registration. So that depends upon from which university, which credentials you are approaching ADC. So ADC exam is for assessment of the skills of a dentist. Okay, if you have a degree from a university which ADC recognizes, okay, this is already equivalent, all the graduates of this university would be matching our skills, so they will not take it is not required for you to give the skills assessment. You will directly approach ADC for registration purposes. Hope that
Yes, Abdullah, I think you can write to ADC and ask, you can give us detail basically like in the email from which university you graduate and what is your status basically regarding your registration. Yes, Shazad, Doctor, are you able to read? 1.5 years is saying after graduation, he's not touched any book, so it is possible for him.
yes,
Yes,
definitely.
definitely.
Definitely, it's like you have already done BDS and you have, the what is enamel dentin pulp and the base of nomenclature, and we will take it from there. And if you still have doubts, we will take it even dig deeper and take you there. So time is not a issue. People have done ADC even after 5, 10, 7 years of
Yeah.
their BDS. They have gone into complete clinical practice, started reading after, say, a career gap of 7, 10 years, and cleared ADC. So it's time is not the criteria there.
Thank you so much. I think we can bind up here. Dr. Ankita, thank you so much for your time.
Thank you, everyone.
Yes, the practical classes are online, offline. We will see once we are providing this can be a mix up because we can provide the online and some might you need to be the offline for the part 2. But this part 1 totally is online. Okay, thank you so much, Dr. Ankita. Tausif, we can wind up. Yeah, okay. Thank you so much, everyone. And please give us your feedback. You can fill this form. We will get back to you. Or if you have any questions, you can ask in that form. You can ask any doubt. Our team will get back to you. Or you can provide your phone number, email in the chat box. Then we will get back to you. Okay. Okay. Thank you so much, guys. Bye. Bye. Bye.
Thank you, ma'am. Thank you, sir.